Hello everyone, I'm Dr. Alan Beyer, also known as Dr. The Dugout, and we're on the road today in Laguna Woods. Back problems are a huge problem in our society today, and I'm joined today by two experts in treatment of spine problems, Dr. Jeremy Smith and Dr. Richard Lee, two fellowship-trained spine surgeons at the Center for Spine at Hoag Orthopedic Institute. And we're going to talk about the common causes of back problems, what you should do when you have a back problem, and I think it's something that everybody faces at some point in their active lifestyle. So Jeremy, Rich, thanks for joining us today.
Thanks for talking about it.
Thanks for having us.
So spine problems are so ubiquitous in the community. Let's talk first about what should somebody do when they hurt their back? They've lifted something awkwardly, they've gotten out of the car or climbed down a ladder awkwardly, and they have pain in the back or down their leg. Let me hear from both of you guys just a couple of pointers, kind of like we do in sports medicine with RICE, with rest, ice, compression, elevation. It's different for the back. What should people do when they first experience the onset of a back problem? Go ahead, Rich.
Sure. Well, you know, as you said, Alan, back problems are very common and ubiquitous in our society. The most common cause of a back problem is really a simple muscle strain. The first thing to do is rest, and you can ice the area also, and relax for a few days and see if that by itself doesn't make the problem go away.
So Jeremy, what danger signals should people look for that might necessitate dialing that up a little bit? What should they do if those first couple of things aren't working, or what things occurring should make them maybe seek medical help a little faster?
Well, the first part of the evaluation of the onset of back pain, if there's any symptoms that relate to the legs, if there's any numbness, any tingling in the legs, any type of weakness, certainly that's something that is a little bit more concerning with regard to neurologic issue associated with a back problem. But as Dr. Lee said, it's most commonly associated with a muscle strain. If it's associated with these other conditions, then it might be there might be some underlying degenerative process or compressive problem on the nerves in the back.
And then people who are, especially in my generation, the people who are 55s and older, who might have some pre-existing back condition, sometimes it could be a rather minor little injury that suddenly sets off the whole cascade of events. So any other things that they should think about if they've had previous episodes, or where they should seek help right away? I mean, bowel and bladder problems are always things that we talk about. What else should they be looking for? Rich?
Well, sure, yeah, as you mentioned, bowel and bladder problems would potentially signify a significant neurologic injury to the nerves that travel through the spine. If somebody loses control of bowel or bladder function, or if somebody loses sensory function down there, what we call saddle anesthesia, losing sensation down there would also be a significant event that you might want to go straight to the emergency room or straight to your doctor's office for. Any loss of motor function would be another reason to seek medical attention sooner rather than later. Motor function being muscle strength in your lower extremities.
And needless to say, that could all be their upper back too, their neck, if they're getting weakness or loss of sensation in their arms after a neck injury, after an auto accident with a whiplash.
Right. Sometimes the symptoms that arise from a neck problem may be much more subtle. Simple things like coordination problems of the hands, things that become difficult, simple things that like buttoning up your buttons or tying your shoes or handwriting changes might signify something more dangerous and more of a significant neurologic situation.
So let's talk about what comes next. They haven't gotten better a little bit. People hear the word surgery, and when the words spine and surgery used in the same sentence, it really kind of freaks them out sometimes. Let's talk a little bit just to reassure the folks out there that just because we're orthopedic surgeons, very few of these people really wind up going to a surgical procedure that they're so afraid of. So for them to not seek medical help because they're afraid of spine surgery, let's allay those fears a little bit.
No, I think 95% of the patients I see in my office are really do not ever require surgery. In fact, it's very, very rare upon seeing a patient for the first time that a surgery is indicated. So really the options of a conservative course of management that can often be very successful is very appropriate. So surgery is something that, this day and age, there's a lot of conservative options, and fortunately that if those options do not work or if things are worsening, we have much better surgical procedures that are less invasive that we've been doing a lot of at HOI.
So if they sought orthopedic help, Rich, let's talk about what some of those conservative measures are, because there are some out there, people are promising the moon with cold lasers and things like that, which don't necessarily do the trick. Tell the people about what kind of conservative modalities you guys are using before they get anywhere near the operating room.
Yeah, there are numerous amounts of strategies that one can employ for treating back pain. Probably the more common strategies would include things like rest, activity modification, physical therapy, exercise, core strengthening, and non-narcotic medications, non-addictive, non-narcotic medications. There are various types of injections that people sometimes can also get for treating back pain and neck pain. Things like what you mentioned, cold laser, that is a modality, although there isn't as much evidence or as much scientific evidence out there to support certain modalities versus other modalities. But I would say far and away, exercise, physical therapy, weight loss, those would be the primary types of strategies, and non-narcotic pain medications.
I usually like to tell people that if something sounds too good to be true, it usually is. And kind of the axiom to that is if insurance companies are refusing to pay for something, that usually means it's something you should look at a little closer before you deep dive into it. What do you have to add to that, Jeremy?
Great point. I think that if you just Google back pain, you'll get literally tens of millions of hits, and a lot of these unfortunately are products that are preying on an individual who is desperate. And there's a lot of pain, and certainly it's something that may not resolve immediately with a short period of time. So there's a lot of things out there that aren't proven. There's no science to back it, and they're very expensive. So I think that in a situation when this isn't resolving with a basic conservative course, going that route and really looking into these traction therapies, the cold lasers, these things that cost thousands of dollars, really aren't reputable, don't have any science behind it. I think prior to considering that, it's better to see a physician and look at exactly what you said, things that have been approved and are covered by something like Medicare. Well, there's a little bit more science behind that, and it's worth going along that route first. But just to echo what Dr. Lee was mentioning, I think exercise and activity, maintaining your core strength, all these things are the crux and really the key points in maintaining your health and number one, preventing an injury and also curing an injury. So I think that is really the foundation, and everything around it helps you get to that point.
So let's say that all the conservative stuff hasn't worked. The person still is plagued with back problems, back pain, leg pain. Let's talk a little bit about all the advances that have happened in the last years in terms of the surgical treatment of spine conditions. Give us a little bit of an update on where we're at now on state-of-the-art spine surgery today compared to what the horrors that people remember from 15 or 20 years ago. Rich, tell us a little bit about the minimally invasive stuff, how much faster people are out of the hospital, what kinds of things they can expect.
Minimally invasive spine surgery really just represents a continuum of spine technology. There are certain goals that you try to accomplish from a structural standpoint in spine surgery. Many of those goals are still the same as they were a decade or 2 decades or 3 decades ago. But minimally invasive spine surgery really represents a continuum of the technology and advances in the actual instrumentation used in doing spine surgery and the implants that are used, that are being implanted in patients, and the techniques involved in delivering those implants into the human body. Minimally invasive in today's world of spine surgery really is referring to how much tissue disruption or tissue dissection that you're subjecting the patient to during the procedure itself. And as time has continued, and as the bioengineers have given us better tools and better implants to use, we've had to do less and less tissue dissection. With less tissue dissection, there's less soft tissue healing that has to occur post-surgically, which allows patients to get up and move around and recover a little bit faster than traditional methods maybe a couple of decades ago.
So Jeremy, everything can't just be done with a Band-Aid on the wound at the end, like some of the TV ads kind of try to make us believe?
You know, I think there's a few things that just don't exist in spine surgery yet, and that's robots, lasers, and stem cells. And maybe someday we'll have those, but as of now, I think that really the standard, the gold standard of techniques still involves some of the same ideas that we had many years ago, and they're just have been perfected. So we can do them through, rather than an incision like this, through two very small incisions, and this will limit hospital stay and limit blood loss. And so, but the promise of doing something more with a laser or something very less invasive with the Band-Aid, it just doesn't quite exist. So again, going back to referring to what's covered by Medicare, I think that's actually a very tried and true rule that I tell my patients as well. And I'm asked a question about laser spine almost every day in my clinic, and the first question I ask is, well, is it covered under Medicare? What are they asking up front? And the typical answer is, well, they're asking for $2,000 up front for a consult. It just doesn't exist. So I think that's something that in the future we may have that, but as of now we really don't.
So we got a couple of minutes left. I want to concentrate a little on what our TV audience can do to try to not have to seek out your services. What's the best advice you can give people to keep their spine in shape, not need the expertise of a spine specialist like you guys? So let's throw some pointers out there for our listeners today. Rich, why don't you start on that one?
Well, I think the number one thing that people can probably do is stay in good shape. A well-balanced diet and a well-balanced exercise course to keep yourself in tip-top shape is the best route to go. Stay within an ideal body mass index range for your height, and keep your core strength up. I think if someone can do those things, that'll probably give them the most mileage in their neck and in their backs.
Jeremy, what do you have to add to those words of wisdom?
Exercise, 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 and exercise. I think that's the key thing. I think you got to find what's right for you, and if it's too complex of a regimen, it's something that you need to find that you're able to do every day that really keeps you going. I think that's the key thing, is to keep mobile. As we age, our bodies want us to slow down, and you can stop that by continuing to go through. And as long as you have a program that you find fits your needs and you're able to do on a daily basis, I think that's the key thing, is to keep mobile and to keep exercising.
So we wouldn't be complete for our audience without addressing a little bit the problem with osteoporosis and vertebral compression fractures. We're dealing with an age group here where people are osteoporotic. What would you recommend in terms of their testing, their dietary supplements, whether they need medical treatment? How do you handle that with your patient population, Rich?
Well, with regards to testing, getting a bone density test through your primary care office to establish a baseline in your golden years is a good idea. And if you are at risk as determined by that baseline test, you may need to get some follow-up scans in future years. In order to try to prevent some of the bone mineral density issues, it's a matter of trying to exercise and trying to do some resistance exercise at the gym, do light impact sports in your golden years. Light impact meaning maybe heavy walking, maybe a aerobics class, and weights, using resistance training, weight training in the gym to build up that bone density.
So there you have it, folks. The word exercise has been said about 20 times in the last 3 or 4 minutes. You can't get away from it. If you don't do it, you're going to be spending more time with these guys. Rich and Jeremy, I want to thank you so much for taking this time out today to try to put the information out there and keep everybody healthier, keep their back free from problems. And that about does it for our time today, but I want to thank Dr. Rich Lee and Dr. Jeremy Smith from the Center for Spine at Hoag Orthopedic Institute for bringing us up to date on what's going on in terms of taking care of you and your low back. This is Dr. Alan Beyer, your doctor in the dugout, and thanks for watching. We'll be back again soon.